Sure. So Lacutamab is an anti-KIR antibody, which is specific epitope of D3L2. So it's a specific ligand, and NK cells are very important cancer surveillance and also anti-infective immune cells. And what the situation in the setting of cancer is that sometimes NK cells may not work optimally. And the NK cells typically don't need a whole lot of stimulation to go and look at the bad cells and get rid of them. In this case, what we're doing is we're trying to point out the protein in the cancer cell that is expressed that attracts the NK cells into that setting so that the NK cells can then mount an attack and kill them. So this particular protein is a KIR3DL2, so an antibody against that obviously will direct the NK cells towards this. This drug has done well in various malignancies, particularly in cutaneous T-cell lymphomas. There was an abstract and a presentation last year, and the reason is the expression of this protein D3L2. KIR3DL2 is very high in cutaneous MF and cutaneous T-cell lymphomas. And I saw a response rate of about 45 to 50%. So in nodal T-cell lymphomas, the expression levels are not the same as in mycosis fungoides or Sézary syndrome. So what we sought out to do was to look for those patients who had that expression. So it appears that about 40 to 60% of all T-cell lymphomas do have that expression, which means you have to go by the biomarker approach, choose the patients who have that expression, and then offer them the antibody. Since this antibody has already been vetted and we have phase 2 data, so we went ahead with doing a phase 2 study, and this is more of a dose finding and also a futility study analysis that is done. And we have data on 10 patients that is presented, and we don't have any long-term responses because the data cut was not ready for this. But at the same time, what has also been done is Lacutamab as a single agent in nodal T-cell lymphomas, acknowledging that may not be enough in the nodal T-cell lymphomas, we set forth several models in the preclinical setting to see how we can synergize the Lacutamab. So for example, the Lacutamab is being combined with the standard of care therapies like CHOP, chemotherapy, or with Palatrix in the relapsed refractory setting, or with Bendamustine. And these mouse models in the poster presentation yesterday show that when you add Lacutamab to each one of those combination therapies, you get a very high synergistic effect. And it sort of sets the stage for trying to look into Lacutamab in combination with other standard therapies. So that's a summary of our poster presentation from yesterday.